I'm Lena Metlege Diab, and I'm the Member of Parliament for Halifax West. First, let me say welcome, everybody, to my Halifax West riding. And, of course, welcome, thank you very much to the Nova Scotia College of Nursing, to the CEO and Registrar Sue Smith, and all the staff that is here for hosting us. And, of course, for all the great work that you are doing. We only just saw a snippet of it this morning, but thank you very much. So we're here for a very exciting announcement, and we will be joined by a few guests. First, I want to say bienvenue à mon collègue, le ministre, l'honorable Jean-Yves Duclos, Minister of Health for the Government of Canada, and also my colleague, the Honourable Sean Fraser, Minister of Immigration, Refugees and Citizenship of the Government of Canada, who will each be speaking together with Sue Smith, the Registrar. But also welcome to my colleagues, Darren Fisher, Member of Parliament, and Daryl Samson, Member of Parliament as well. And I did see, and I think they're still here, two MLAs with us from the province, Braden Clark and Rafa Di Costanzo. Thank you for joining us. Et merci à chacun de vous d'être ici aujourd'hui pour apprendre comment l'immigration peut nous aider à combler les pénuries de main-d'œuvre dans notre système de soins de santé. Thank you to all of you for being here today to hear about how immigration can help us with the labor shortages that we have in our healthcare system. So healthcare may be the primary domain of the provinces, but Canada has a federal Minister of Health who never stops listening and, more importantly, never stops acting to make public health care better in this country. So back in April, I personally partnered with iSense to host an information session for internationally trained healthcare workers to connect them to credential recognition, resources, and to hear their experiences. Minister Fraser and Minister Duclos know that this is a passion of mine, and so they chose this location. No, just kidding. But so thank you for being here, actually, to give me the chance to say thank you to both of you for the great work that you're doing for Canada, but obviously for Nova Scotia today. And you all have the drive to make progress on getting people with the skills we need to work in the healthcare field. So this is a big deal, and I'm very proud of the work that we're all doing for Canadian patients. Alors, maintenant, je suis heureuse de vous présenter l'honorable Sean Fraser, Minister of Immigration, Refugees and Citizenship. Minister Fraser, welcome to the podium.
My routine at every announcement is to adjust the microphone before I begin. Look, thank you so much, Lena, for your very kind introduction and for having us here in your constituency. I'm absolutely thrilled to be joined by my friend and colleague, the Honourable Jean-Yves Duclos, the Federal Minister of Health. And due to a schedule change, our friend with the provincial government, Minister Balser, was unable to join us, but she's been a terrific partner to work with from the very first day on the job. Le Canadien accorde avec raison beaucoup d'importance à notre système de soins de santé, mais celui-ci a subi d'importantes pressions. Des salles d'urgence qui débordent et des attentes pour chirurgie importantes sont des réalités très courantes. Même si nous n'avons pas été personnellement affectés par la pression dans le système de soins de santé, nous connaissons tout quelqu'un qui l'a été. Et les répercussions ne sont pas vécues seulement par les patients. Les travailleurs de la santé se menèrent et sont aussi très profondément les tensions et le stress. Notre système de soins de santé est très complexe et la solution n'est pas simple. Une chose est cependant certaine, nous avons besoin d'un plus grand nombre de travailleurs de la santé. Folks, let me just get underway here by saying that we're going to bring more healthcare workers into this country. The reality is we know that health occupations have been suffering from severe labor shortages in recent years. You don't have to pore over the data that we can readily access with Health Canada or with provincial systems to understand. Talk to anybody in a community who's been dealing with delays in the healthcare system. Talk to the healthcare workers who are under severe stress. Talk to the people who are standing here who are now helping process thousands of applications for people who want to come and practice here in Nova Scotia. We are going to do something dramatically different in terms of how we're going to run the immigration system to address some of these needs. For those of you who aren't familiar with how the Federal Express Entry System operates, which is our flagship immigration program to attract workers for economic reasons to Canada, historically it has assigned people a score based on a range of factors, whether it's your age, your level of education, your work experience, and a number of other factors that will assign you a score at the end of your application process. The system historically has taken the highest scoring people regardless of which sector that they work in. I was joined about a month ago on Parliament Hill with my colleague Jean-Yves Duclos to announce a change to that process, that we would be targeting 5 key sectors that were suffering from severe labor shortages. Those sectors included health, the STEM professions, agriculture, transportation, and the skilled trades. But the first sector that's going to benefit from this new process is healthcare. And today we are going to be launching the first round of invitations to apply through this category-based model. Today we're going to be issuing 500 invitations across Canada to apply, and within about a week there will be 1,500 more. The reality is that this new process is going to allow us to, we expect, double the number of healthcare workers that will come through the Federal Express Entry System as soon as this year. This is a big change in the way that we're going to attract healthcare workers to this country. For those who don't know how important immigration is to attracting healthcare workers to Canada, between 2017 and 2022, we've welcomed over 21,000 healthcare workers to Canada. But we can do more, and with this new tool, we are going to do more. The reality is, when you knock on doorsteps during an election campaign or where you take meetings in a constituency office, you're going to hear in Nova Scotia and in many communities across this country that healthcare is the #1 concern for so many families. And I can tell you, although it might be traditionally thought of as an area for provincial governments to act, because it is provincial responsibility under the Constitution of Canada, nobody sitting across the table from you wants to hear that it's not your problem, it's someone else's to solve. The reality is there's things we can do, there's things that we are going to do as a federal government, and we're willing to pull every lever that's at our disposal. I won't spoil some of the announcements that I'm sure Jean-Yves will want to highlight. Suffice it to say that we are making record transfers to provincial healthcare systems. We are doing what we can to leverage immigration tools, not only with today's announcement, but previously making changes that allowed physicians to take part in the express entry system who previously couldn't if they had a fee-for-service arrangement because it wasn't open to self-employed people. That's a change that we made last April. We're also making great strides on foreign credential recognition, like the $115 million that was included in the 2021 federal budget. We're also making changes to the way we forgive student loans for people who provide primary care in rural communities. And of course, with today's news, we're going to be welcoming thousands of additional healthcare workers in this country. C'est un grand plaisir d'être ici pour une bonne annonce. C'est un plaisir aussi pour présenter mon ami, l'honorable collègue Jean-Yves Duclos, le ministre de Santé pour Canada. Jean-Yves, it's wonderful to have you here. I'd invite you to come offer some thoughts on today's important announcement that's going to strengthen the public health care system in this country.
Bonjour tout le monde. Good morning, everyone. Thank you, Sean and Lena. It's great to be here in the beautiful city of Halifax, in beautiful Nova Scotia, to make a critical announcement demonstrating, as Sean just said, our joint commitment to collaborate with provinces and territories, especially with Nova Scotia, to improve healthcare by improving our immigration system. I'd first like to give a special mention to Lena, who, as many of you would know, was once immigration minister in Nova Scotia, where she too led the charge in so many ways to help create better pathways to immigration for new Canadians. In 2018, she launched the Physician Immigration Stream and led a team to the UK and Ireland to recruit more family doctors for Nova Scotians. Since joining our federal team, her experience continues to help guide our progress on crucial steps to grow our health workforce, such as what's been announced here today. Lena is also being recognized today by Mount St. Vincent University, where her name will appear on the Riva Spatz Women's Wall of Honor for her commitment to advocacy and the advancement of women everywhere. Thank you for your remarkable work, Lena, for your leadership and partnership. I also want to acknowledge the presence of my dear friends and our dear parliamentary colleagues, Darren Fisher, Member of Parliament for Dartmouth, Cole Harbour, and Darrell Sanson, député de la merveilleuse circonscription de Sackville, Preston, Chesapeake, who represent the strong voices of their constituents in Ottawa. Thank you also to Sue Smith, CEO and Registrar of the Nova Scotia College of Nursing, who are our hosts today. And welcome to the seniors, health workers, and community partners also joining us. Thank you for everything you do. Comme l'a mentionné le ministre Sean Fraser, la première ronde d'invitation pour la catégorie des soins de santé est en cours. C'est une excellente nouvelle pour les patients, les travailleurs de la santé et toutes les Canadiennes et tous les Canadiens. It's no secret that Canada's healthcare system is under enormous strain, particularly in the wake of the COVID-19 pandemic. Canadians are rightly concerned, and so are we. As Minister of Health, I can tell you that in no sector is a labour shortage more prominent than in the healthcare sector. Celles et ceux qui restent craignent qu'on leur impose un fardeau supplémentaire. Le nombre total de postes vacants dans les professions de la santé a plus que quadruplé au cours des 7 dernières années. According to RBC, Canada will be short of 44,000 physicians by 2028. About 70% of those will be family doctors, who are usually the first to provide care, treat, and diagnose Canadians. And when it comes to nurses, an analysis conducted in 2018 anticipated a shortage of more than 100,000 by the year 2030. And that was before the pandemic. We know that this is a challenge that will persist unless we take action. So let's now turn to solutions. Last February, we announced a working together plan with provinces and territories, which will deliver a 10-year historic additional investment of nearly $200 billion to improve health care for all Canadians. It's a collaborative plan with the provinces and territories, rooted in our shared health priorities to ensure Canadians get the care they need, such as expanding access to family health services, especially in rural and remote areas, supporting health workers and reducing surgical backlogs, increasing support for mental health and substance use, especially for younger Canadians, and a better use of and better access to health data, and that's because data saves lives. Since that announcement, we have reached agreements in principles with most provinces and territories, and we're continuing to work together on the next steps of this plan. A key common priority is to support the retention, the training, and the recruitment of health workers, as well as to streamline the recognition of credentials for those trained in other jurisdictions or abroad. Indeed, one way to support the health workforce is through immigration, and the Canadian government is here to help. As Minister Fraser said, recent changes made to the express entry category-based selection allow Canada to welcome people who have the skills we need to fill worker and specific worker shortages. Prospective permanent residents with work experience in healthcare will be invited to apply. This will facilitate, fast-track, and streamline their permanent residency application. Les changements apportés à la sélection par catégorie d'entrée express faciliteront le recrutement de davantage de travailleurs de la santé au Canada, y compris davantage de nouveaux arrivants francophones. Tout le monde va y gagner. Les patients au Canada sont gagnants parce qu'ils pourront compter sur les compétences des travailleurs de la santé qualifiés dont nous avons désespérément besoin. Quant aux nouveaux arrivants spécialisés dans les soins de santé, ils bénéficieront d'une voie d'accès rapide et simple supplémentaire à la résidence permanente. Bien entendu, nous devons nous assurer que ces travailleurs de la santé soient en mesure d'exercer leur profession dès leur arrivée au Canada. Par conséquent, nous collaborons avec les provinces, les territoires et d'autres partenaires, comme le Collège de la Nouvelle-Écosse, pour accélérer la reconnaissance des diplômes étrangers des professionnels de la santé formés à l'étranger. We are therefore working with provinces and territories and other important partners like the College to streamline the recognition of the credentials for internationally educated health professionals. Over the last few weeks, we have seen very good progress to make sure that when newcomers trained abroad arrive in Canada, their skills are quickly recognized so they can start working quickly at the service of patients who are in such great need of care. Our host today, the Nova Scotia's College of Nursing, has shown great leadership on that front by recently announcing a first-in-Canada licensure process for nurses coming to the province from 7 different countries. And I think that deserves a big hand of applause. This initiative, led by the college, has reduced administrative requirements and decreased licensing time, making it easier for internationally educated nurses to practice in Nova Scotia while maintaining strong standards for licenses. I want to congratulate again Sue and her team on this progress and showing what we can be doing together when we work together. I know this initiative would not have been possible without the strong support and leadership of the province of Nova Scotia. At the same time, we have also agreed to improve labor mobility, starting with multi-jurisdictional credential recognition for key health professionals. This will allow well-trained healthcare professionals, like doctors and nurses, to go where patients need them most in any province or territory in the country. In that regard, let me also congratulate Nova Scotia for its leadership in setting up the Atlantic Physician Registry, again a first-in-Canada interprovincial licensure plan. Ces efforts viennent étayer d'autres mesures visant à renforcer le système de santé canadien et appuyer nos travailleurs de la santé, telles que l'exonération du remboursement des prêts étudiants pour les médecins et le personnel infirmier qui travaillent dans les communautés rurales et éloignées. In conclusion, we know that over the course of the past few years, our healthcare sector has been hit extremely hard. We also know that it is not just a labor shortage today that we need to be concerned with, it's a skills shortage for the next generation as we continue to experience an aging population of citizens and an aging population of workers. We need to bring workers who have the needed and necessary skills to provide care for an aging population. With today's announcement, we are opening the door to welcome more of these in-demand qualified health workers. From personal support workers to orderlies to nurses and so many more, these highly trained health workers will help care for Canadians and keep our healthcare system working. By doing so, we can help ensure that everyone in Canada has access to high-quality, accessible healthcare, no matter who they are, where they live, or their ability to pay. Thank you, merci, and with that, I will gladly and happily turn to Sue Smith, CEO and Registrar of the Nova Scotia College of Nursing.
Merci. Thank you, Minister Duclos. On behalf of our awesome staff, welcome. Welcome to our home, the Nova Scotia College of Nursing. It's my pleasure to be with you this morning for such an important announcement. And it's so important for the country and for those individuals who are seeking to make Canada their home. Immigration has always played an important role in the history of this country, and the Government of Canada's announcement this morning is further testament to that importance. As we all know, addressing the healthcare staffing crisis requires all healthcare system players and innovative solutions. This is why we're pleased with the government's announcement about the new approach to immigration in Canada. As the Nova Scotia College of Nursing, it is our role to regulate all nurses in Nova Scotia on behalf of the public interest first and foremost. One way we do this is to ensure that those who qualify to practice demonstrate that they're safe, competent, and qualified to do so. This includes international nurses. We challenged ourselves as a regulator to really rethink our approach to registration and licensure. And while still ensuring the safeguards to protect public safety, on May 1st, we introduced the streamlined registration for qualified international registered nurses licensed in good standing in 7 countries. the Philippines, India, Nigeria, the UK, the US, Australia, and New Zealand. They take about 87% of the international nurses that have applied over the last decade to work in Nova Scotia. Our modernized process, we changed how we do it, but we didn't change what we do. We're pleased that the changes provide the public with greater access to care and safe, quality nursing services. And as of yesterday, we had received, since May 1st, well over 10,000 applications for licensure. And we have set a goal that by the end of December, we will have over 5,000 approved for licensure. It's these guys. First in Canada. Premier. Collaboration is so very important. And we know that part of the system for international nurses will require support from immigration, employment, housing, and settling. And it's always been important for us to work with our healthcare system partners and to recognize the needs of the healthcare environment so we can make positive changes for the public. This is a very exciting day, and NSCN is truly pleased to be a small part of this very historic announcement. Merci tout le monde. Thank you.
Thank you, Mrs. Smith. So I'm going to ask Minister Fraser, Minister Duclos, and Mrs. Smith to come back to the podium. We will get started with our media question and answer session. I will ask reporters to, if they have for those who have a question in the room, please signal to myself or my colleague at the other end of the room. We will bring the mic to you. You will have one question, one follow-up. We will ask that you provide your name, the media you're representing, and the minister to whom, or the guest to whom you direct your question. For our folks on the line, we will ask you for the same things. So before we move to the questions on the floor, operator, would you like to cue the reporters on the phone? Operator?
Certainly. Thank you. Merci. We will now take questions from the telephone lines. Nous allons maintenant passer à la période de questions. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There will be a brief pause while participants register for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Notre première question.
We will start on the floor and we will come back to the phone very quickly. I will just.
Perfect, thanks.
Nous allons donc procéder maintenant avec la période de questions des médias. Nous allons alterner entre les questions au téléphone et celles dans la pièce. Vous aurez droit à une question et une sous-question. Nous allons vous demander de vous nommer, le média que vous représentez, ainsi que l'invité à laquelle vous souhaitez poser la question. Donc, nous allons commencer. We'll start with a question on the floor.
Thank you. Hi, this is for Minister Fraser. I've both of my questions. This is Sarah Plowman with CTV News here in Halifax. So you mentioned in your address just the number of people who will be able to enter under this new program or this change. My quick math showed that it would be about, I mean, how many are going to be coming each year? You said that there was about 21,000 over 5 years, which breaks down to like 4,200 a year. Are we going to see more than 8,000 a year, or how many?
So just to express clarity, there's a couple different numbers through different programs that might be confusing the situation. So currently under the Federal Express Entry system, that only represents a portion of the people who come to Canada each year. The 21,000 between 2017 and 2022 was across a variety of different programs. I anticipate that, although we won't know exactly until applications come through and are processed, we would typically have just shy of 4,000 or so currently each year through the Federal Express Entry system. As a result of today's change, we expect that number is going to double to be close to 8,000. But in addition, we've also made significant increases changes to the provincial nominee program allocations to provincial governments, about a 44% increase across Canada over the past couple of years, and more dramatically here in Nova Scotia. Traditionally, more healthcare workers will come through the provincial nominee program because provincial governments have the ability to better understand where the needs are in their healthcare workforce. As a result of this change, we're going to supplement the additional spaces that provincial governments have. So under the federal stream, there will also be more healthcare workers coming to Canada. So the total number under the federal stream may be closer to 8,000, but the total number could be dramatically higher than that, depending on decisions taken by provincial governments as a result of the increased allocations to their programs.
Okay, thank you. And this is a question for my colleague on a different story. He's talking about the carbon tax today. As you know, it's coming soon to this province. And despite the rebate, not everybody has that buffer cash around while they're waiting to get that rebate back. So what advice do you have to them?
We're very aware of that. When we wanted to make a decision that put more money in the pockets of families than they would pay as a result of the fuel charge, that's why we actually are putting on the front end the benefit that people are going to receive. In just a few weeks, families are going to receive their first quarterly payment. A family of four will be just shy of $250, and they'll receive 4 payments this year. By making sure that families have access to the money before they feel the pinch of any increased cost for fuel, we know that they're going to be able to deal with any increased expenses because they're actually going to have more money in their pockets. One of the things that I think people need to understand is the atmosphere belongs to all of us. When it's damaged, you should get paid by the person who causes that damage. That's how carbon pricing works. Everybody gets an equal rebate, but the people who are the largest polluters pay more. Typically speaking, it's wealthier individuals in our communities who pollute more because they own multiple cars, they take more vacations every year, they have larger homes, and I think it's fair if they pollute more than a low-income person who may not be able to deal with an equal expense, that the person who pollutes more should contribute to a fund that's going to put more money in the pockets of those low and middle income families. So we were very aware of the need to address this, and that's why we didn't wait until the end of the year, but instead in the first few weeks of the system being in place, families should receive checks very quickly.
Thank you. We'll go to the phone. Operator, do you have someone who wants to ask a question?
Certainly, yes. Our first question is from Laura Osman from the Canadian Press. Please go ahead. À vous la parole.
Good morning, ministers. Can you hear me all right?
Yes, we can hear you fine.
Wonderful. My question is for Minister Duclos on the PBO's report today on dental care, which shows that the government set aside perhaps more money than necessary. It may be coming in under budget, which is great, unless provinces drop their coverage. And so I'm wondering, Minister, if you can shed any light on the discussions that have been happening with your provincial colleagues about making sure that provincial dental programs are maintained.
Great question, and a couple of things on that. First, we are obviously grateful for the PBO's contribution to an important plan that will help when it is fully in place, almost 9 million Canadians. Second, we do have internal estimates that validate our future projections of the cost of the dental plan. We also now have public evidence of the value of investing in oral health care. More than 310,000 children have now received the Canada Dental Benefit, which is more children than we thought would get the benefit. And that's a sign that there is a need in lower income and middle income families for such a plan. And then I would also add that the collaboration with provinces and territories is absolutely essential. Although only 5% of current dental expenditures are covered by PT plans, there is, including in Nova Scotia, there are families, typically low-income families, and for some aspects of dental care that are paid for by the province and the provinces, and we are therefore continuing to work collaboratively with them as we put that important plan into full shape in the next years to come.
Thank you. I've been speaking with experts and provincial health departments about sort of the uneven patchwork of dental care programs across the country. How will the federal government address that fairness aspect that some provinces have brought up, in which they already provide more fulsome dental care programs than some of their colleagues?
Good. It is indeed uneven. What is common, however, is that the coverage is relatively weak. It's typically very income tested. The vast majority of middle class families are not covered by public by existing public plans. When the families and the seniors and the children are covered, the basket of services covered is typically quite restricted. In my home province, in Quebec, for instance, all of the preventative dental care services are not covered for children, including for children under the age of 10. That means that prevention, unfortunately, is lacking in many contexts. Families are not bringing their children to the dentist, to a hygienist, and that leads to problems that are more costly and more difficult to treat thereafter, with all of the other adverse impacts of not having good oral hygiene. Now, we know that it has an impact on diabetes, on hypertension. It can lead to generalized infections. So these are problems that can typically be treated easily when they are treated quickly, but unfortunately the lack of strong coverage across Canada is making the situations of families and children and seniors quite difficult. So the situation is uneven, the coverage is relatively modest, and that's why the federal plan is going to make it more homogeneous and a lot stronger for families with lower and middle income in the country.
Thank you. We are into a question here.
Hi, Sarah Zabansky, All Nova Scotia. My question is for Sue. You had said about 10,000 applicants since May 1st, so that's about 5,000, give or take, a month so far. Are you expecting that to kind of keep going? And how is processing going? Do you need more staff? You know, how do we get more of these applications kind of through and licensed?
You were just in our staff room, weren't you? Because we were talking about that. Actually, the incredible thing was within the first week, we had over 8,000 applications, and we continue to learn in this process. And so we have seen a leveling. As we say, it's only been since May 1st, but certainly we will continue to process as many as we can. And we started before Christmas with 4.5 FTEs of staff, and as of next Monday, we will have 28. And many of the teams are here and back here, and it's impacted the whole college, but we have specifically looked at our processes and really we have 3 core processes, and we continually look at the application form, what's mandatory, what can we not need at this point in time. So we're continually looking at how we can further streamline the process. So that's why we have targets for each week and continue to hire the staff. But we're pretty confident with our final group of folks, with 28 additional folks assigned to this, that we'll be able to make a significant dent into the numbers.
My next question is for Minister Fraser. I'm just going to hold that for 1 second while I flip back. It's just from a colleague, so let me grab it. Thank you. Premier Tim Houston says he's not interested in the Atlantic Loop project unless it includes significant cash from the federal government and guarantees for cost overruns and the price of power. Will the federal government improve on the deal and meet demands?
So first of all, I have a positive working relationship with the Premier. We're neighbors back in Pictou County, and we've worked alongside each other as local representatives from my very first day in office. One of the things that I find challenging about this particular file is we've got the provincial government who campaigned on a commitment to get off coal by 2030 and to also embrace the Atlantic Loop at that point in time. We've been engaged on this project for a number of years, and we've identified it as the least costly option for households. If there is an alternative plan, I'm interested in what proposal may come, but to date we haven't actually seen one. We don't want to run the risk of continuing to burn coal, which doesn't only have serious deleterious environmental impacts, but it has serious health impacts on families, heart conditions, and asthma for children. But it also makes Nova Scotia a less competitive jurisdiction when we're trying to attract industry that's going to do business in this province when they're selling goods that they market to their customers as being free of fossil fuel emissions. If there are alternative proposals that are least costly, of course, we're interested in hearing what they may be. But to date, by far the least costly option that anyone has identified with something more than back-of-napkin math is the Atlantic Loop. We're going to continue to work with provincial governments, we're going to continue to work with utilities, and we're going to continue to work with families who demand clean energy but also want to do it in an affordable way to find the best solution. It's essential that we get off coal. It's essential that we get to net zero. We are going to achieve those goals, and we're going to partner with anybody who's willing to come to the dance floor with us.
Thank you. Operator, you have a question on your side?
So, Jenny, we have a next question from Uday Rana from Global News. Please go ahead. À vous la parole.
Thank you. My question is for Minister Fraser. Minister Fraser, you announced this entry for healthcare professionals, and yesterday you made an announcement regarding STEM professionals and a separate stream of entry for them with very short processing times. And, of course, that depends on the IRCC's ability to be able to quickly process those visa applications. How do you square that with the fact that we've consistently seen pretty high backlogs as far as permanent resident applications are concerned and other visa applications as well?
Look, this is a really important question. It's one thing to have streams, but if you can't offer predictable timelines, they're not much use to anybody. Since you focus your question on some of the economic streams, think about the position an employer has to be in. If you tell them you've got a great pathway, but you can't guarantee when the worker's going to get there, businesses and healthcare systems need workers immediately, and predictability in timelines is key if you're going to have a functioning immigration system. When I was appointed to this position, it happened to be at a particular moment in time, shortly after the borders opened up, after the COVID-19 pandemic public health measures had been relaxed. What we saw over the course of the pandemic was an extraordinary negative impact on processing times in Canada's immigration system. You can imagine it doesn't take a rocket scientist to figure this out. When you're in the business of bringing people across borders, but you close those borders for public health reasons, it makes it hard to succeed. During the pandemic, we continued to receive applications. So when the borders opened back up, we had a couple of years worth of applications in the system. We layer on top of that challenge the need to respond to the humanitarian crises in Afghanistan and Ukraine, and we had millions of additional applications across programs that really slowed things down. We went to work over the past couple of years by adopting new technologies, including advanced analytics, the embrace of AI in certain aspects of our operations. We also added enormous numbers of resources, hiring almost 1,600 people to help process applications more quickly. And we started reducing administrative barriers that we didn't think were providing enormous value to the system, but would allow us to speed things up considerably. As a result of those changes, despite the fact that you may have seen news stories about backlogs over the past couple of years, a new economic migrant coming to Canada is back to the 6-month standard under the Federal Express Entry system that we enjoyed before COVID-19. Family reunification is back to the 1-year standard we enjoyed before COVID-19. Work permits and study permits are back to 60 days, the same standard we enjoyed before the pandemic. There's a little bit of work left to do on tourist visas, but we expect this summer we'll be back to the 30-day standard that we enjoyed before the pandemic as well. So the reality that we're facing today is very different than the news stories that you would have seen over the past couple of years. We're more or less back to the standard that we enjoyed before COVID-19. But what excites me most is as a result of the productivity improvements that we've made, we're now processing almost double the number of applications that we were a couple of years ago. I expect some of those productivity gains are going to continue to be in place so we can further improve timelines going forward. So with enormous respect to the question, we have now fixed significant problems in the system. We can always improve it further, but the challenges that we were facing over the past couple of years have largely been overcome, and I have a high degree of confidence that we're going to be able to bring workers in both in the tech sector as well as the healthcare sector in order to make good on predictable timelines for employers and healthcare systems across this country.
Thank you. We
Thank you,
have
Mr. Fraser.
question here.
This is for
I have a follow-up
Minister
question.
Fraser.
I think the questioner didn't get his follow-up.
Yeah, please go ahead with the follow-up.
Yeah, of course. My follow-up question is about the STEM professionals stream of entry and whether that includes healthcare workers, and if not, would you be considering a separate stream of entry for healthcare workers in the future?
So there's a couple different programs that relate to the STEM sector, and for clarity of those who are present in the room, yesterday we made an announcement with a focus on the tech sector that included 6 different elements. It included a dedicated pathway for STEM professionals to come to Canada. It also included getting back to a 2-week timeline through the Global Skills Strategy. And it included fixes to the startup visa program for tech entrepreneurs who come and create businesses in Canada that hire others. We also launched new pathways for the tech sector, including a stream we'll develop later this year for the most highly skilled professionals in the world to come with or without a job offer, as well as a new digital nomad strategy and additional measures that are going to make it easier for workers in the tech sector to come to Canada, in particular H-1B visa holders in the United States who've recently experienced significant numbers of layoffs from big tech companies that may be in demand in Canada. So within that suite of measures, there are enormous pathways for STEM professionals to come to Canada. Today's announcement expands the access to the express entry system for healthcare workers. The professions that will be listed, they're published online already, are assigned specific NOC codes. So it would include general physicians, specialist physicians, nurses, orderlies, dentists, and a number of different healthcare professionals. It's possible that some of the STEM professionals, who will also be included in a separate draw that will commence on July 5th, by the way, that those people who have specific occupation codes could work in the healthcare system. I was at the opening of a business in Toronto just the other day. It's an AI company that focuses on medicinal research to discover new drugs. They certainly have an enormous impact on healthcare, but they're coming in as a result, the workers who will come in for companies such as that will come in as a result of them being in a STEM sector. So there are instances where STEM and health intersects, and workers who benefit from these new measures by virtue of the NOC code, the occupation that they work in, will be permitted under either stream, provided that their particular occupation is included in the unique new category-based selection model that we've announced today.
Thank you. Now we will go back to the floor.
For Minister Fraser, Francis Campbell with the Chronicle Herald. So, yeah, I'm going to swing back to the carbon tax. So in 3 days or so, we'll be paying 14.3 cents extra per litre of gasoline for gasoline at the pumps. The federal government's assessment is that most Canadians and most Nova Scotians will get more money back through the incentive rebate than they actually pay in extra tax at the pump. So what would you say to Nova Scotians who would say, why should we have to pay out of pocket, then get the money back? If we're going to get more money back or the same, why have the carbon tax in the first place?
Look, this is a really important thing, and I don't think it's particularly well understood, so I very much appreciate being asked the question. The reality is people who are not big polluters are getting shortchanged already today. The new path forward that is going to issue a rebate to people is going to put them in a better position. It's not as though the money that you will pay as a result of a fuel charge is going to be the same money that you get back. Because everyone owns the environment or the atmosphere equally, when somebody damages it, they should pay everybody for it. Families are going to get more money back, and that's actually been demonstrated to be the case in jurisdictions that already have a carbon pricing and rebate system in place. In Ontario last year, 8 out of 10 families got more money back. The ones who actually were out of pocket a little bit tended to be amongst the wealthiest families in that province. So this system is about achieving fairness and putting more money in the pockets of families by saying when someone damages the atmosphere, they should pay families for the damage that they cause. So this is going to, we also know that this is one of the most effective ways to reduce emissions anywhere in the world. Jurisdictions that have done it, we've seen big success. But the reality here is that we want polluters to pay families for the damage that they cause. This is going to have a positive impact on our environment, but it's going to put more money in the pockets of families. If anybody thought that this actually was going to cost families money, it wouldn't receive support. Nobody, not a provincial official, not a federal official, not a person in our community wants to take money away from families. This policy has been designed in a very particular way to make sure families are left better off. At the same time, we ask those who pollute the atmosphere to cover the cost of the pollution that they cause.
Thank you. Minister Fraser, I understand that you have a scheduling commitment coming up soon, so we have one more question for you.
Okay.
And then we'll let you go.
I'm Madison Irvin with Global News Halifax, and my question is to Minister Fraser. Where are all the new nurses going to live with the housing crisis happening in Nova Scotia?
Look, thanks very much for the question. And I think it's really important that we don't treat we don't lay blame on newcomers for the housing challenges that we face. The answer to our housing crisis across different parts of Canada is not to close the door on newcomers, it's to build more houses. One of the things that's really important to understand is, though today we're announcing the new pathway that's going to welcome healthcare workers, over the course of this summer, the first targeted draw for skilled tradespeople who have the skills necessary to build more homes is actually going to bring in the people that we need to build more homes. We have to think about the counterfactual in Nova Scotia of not embracing immigration as a growth strategy as well before we look at the consequences of embracing immigration. I come from Pictou County. The very first election campaign that I ran in, two of the most controversial issues included the closure of the River John Elementary School and the shuttering of the mental health unit at the Aberdeen Hospital. The largest regional hospital in northern Nova Scotia doesn't have a functioning mental health unit. The reality is that those public services were severely impacted because people were moving away from our communities. My entire life, I watched young people, my classmates, move out of Nova Scotia to find work elsewhere. When they moved somewhere else and didn't raise kids in the community, schools closed. When we had a psychiatrist leave our community, we couldn't safely operate the mental health unit, so it had to close as well. When we have depopulation, as we have experienced in Nova Scotia for most of my lifetime, particularly when that depopulation is disproportionately including young families that could otherwise be here and raising their families here, there are dire consequences. What we've seen since successive provincial governments, as well as the federal government currently, the embrace of immigration is bringing young families into our community. And we're seeing, as more people come and open businesses and hire people locally, families who grew up in the area are actually moving back and raising their kids around too. The challenges associated with growth are very real. Healthcare and housing in particular are facing enormous pressure. But the challenges associated with growth are far better problems to deal with than challenges associated with people moving out of your communities. Look, we had conversations a couple of years ago about schools and hospitals closing because so many people are leaving. I welcome the challenge to build homes to accommodate so many people who want to call Nova Scotia home. We're going to invest through our national housing strategy tens of billions of dollars to help build more homes. We're going to work with municipalities to change the way that infrastructure funding may flow to make sure that they're being rewarded for building housing. And we're going to do whatever we can to attract the people who are actually in demand from home builders who are telling me that the number one obstacle to building more houses is that they can't find the skilled tradespeople to actually do the construction work on projects they have already booked. The reality is we can do immigration and home building at the same time, and in fact, without higher levels of immigration in particular, with the skills that we need in healthcare and the skilled trades, we're not going to be able to reduce the pressure on these important social aspects of our communities, and I think we're going to need to continue to embrace immigration, but do it in the right way so we can help reduce pressures on the system rather than exacerbate them.
Okay.
Okay.
So thank you, Minister Fraser. I understand you're going to have to go.
Okay.
So
I love that the moderator is telling me my schedule is good.
But we have one final question for another one of our guests.
Okay. Well, thank you so much, folks. If I skip away, please don't hold it against me. I very much appreciate everyone's time today.
Hi, my name is Anna Mand, and I'm with CBC, and I have a question for Minister Duclos. Also about the dental plan.
Yes.
So the Parliamentary Bureau officer found this morning a different costing for the next tranche of dental care coverage than the estimate in the federal budget. Which is right? Is it really cheaper than the government disclosed?
Well, we are very grateful to the Parliamentary Budget Officer for digging into this issue. This is about cost, but also about benefits. First, about the cost, we have obviously asked departmental officials to look carefully at how costly this important investment would be to the federal government. And there are estimates internally that we have confidence in, but we also are pleased with the estimates that the PBO is providing, and we'll be looking at them and seeing how different hypotheses may lead to different results. But we're also very much focused on the benefits of the dental plan. It's already more than 300,000 children, including tens of thousands in Atlantic Canada, that have benefited from the Canada Dental Benefit. That, in my community and here in Halifax in particular, has brought young children to see a dentist in many cases for the first time in their life. And that's because those lower income and middle income families knew that they had the ability to pay for those services. Unfortunately, when that's not the case, families naturally wait. They pay for groceries and rent, and they don't have the capacity to bring their children to see a hygienist or a dentist. And as we know, that leads to, unfortunately, potentially bad outcomes in the future. The outcomes can also be short-term. It's speech development, social development, the ability not to miss school days, parents having to bring a child to a hospital for emergency generalized anesthesia because the child didn't receive the preventative services that would have avoided that. So the benefits are very substantial. We're looking forward, obviously, to put into place the full dental program, which is going to be the first ever national program for dental care, and will help up to 9 million Canadians when that is fully in place by 2025.
Anticipate provinces or territories ending any specific programs as the federal coverage expands?
We don't anticipate that because this is a program, A, that is on top of existing programs, and B, we've been working collaboratively very hard with provinces and territories for the last year or so. In my work with provinces and territories, the fact that the federal government adds to the existing investments of provinces and territories is most welcome by provinces and territories, but also by clinicians, by experts, by all those that care about the well-being of our families and children. So we look forward to a continuing positive collaboration and everyone continuing to contribute its share in support of children.
This concludes our Q&A portion. Ceci met fin à notre séance de questions-réponses.